If you're considering a surgery, it is important for you to know all the available options for you. In this video, I will be speaking to you about all the benefits of a keyhole surgery and why in the recent trend it has become so popular and why many people are choosing to go for a keyhole surgery rather than an open surgery. Hi, my name is Dr. Raksha. I'm working in Altius Hospital as a gynecologist. And today I will be briefing to you about the benefits of keyhole surgeries. The potential benefits of undergoing a keyhole surgery is a lesser operation time, a less amount of blood loss, lesser pain and lesser scar tissue which is formed post-surgery and lesser discomfort, and the patient returns back to work at a faster rate when compared to an open surgery. So what are the differences between open surgery and a keyhole surgery? So open surgery, the duration of surgery is longer and there is a lot of blood loss and which necessitates blood transfusion post surgery, and there's also a lot of pain and the recovery duration is quite long and also the hospital stay is quite long. On the contrary, when we take a keyhole surgery, the surgery duration is lesser and the pain post-surgery is lesser and the patient is much comfortable with the keyhole surgery than a patient undergoing a open surgery, and also the scar tissue formation is less both internally and externally, and the external scar tissue formed is very small as the incisions we take are quite small, ranging from 0.5 cm to 1 cm. Here is an example of a patient who is undergoing intestinal surgery by open method. This patient will require a hospital stay of around a week, and also the pain threshold, and depending on the pain threshold of the patient, he might require more analgesics and also he will require more time to get back to his normal work. On the other hand, if the same patient has undergone a minimally invasive surgery by laparoscopy, then the patient will recover faster and he will have to stay in the hospital maybe only for 48 hours, and the recovery duration is just 2 weeks and he can get back to work within 2 weeks. When compared to an open surgery where he will require 3 to 4 weeks of rest, and it will be very difficult for him to get back to work even after 4 weeks because it requires some amount of rest even then. So what about the keyhole surgery? So what is done in a keyhole surgery? The surgeon starts with few incisions of 3 to 4 of 0.5 to 1 cm in length, and through the incision a trocar or tubes are inserted through which we insert instruments, that is the surgical instruments, which are around 3 to 4 mm in diameter with a long shaft. And also we insert a telescope which is connected to the camera for visualization of the internal organs while performing the surgery. Here, though these instruments are quite small and though they're going through the abdomen, the whole idea I know is quite scary, but it is actually very safe, and this technology has given a wider option for the surgeon. A wider vision also is there. There is quite a lot of magnification, thereby it helps in a wider dissection and also ease of the surgery. We at Altius Hospital have performed more than 100,000 cases of gynec laparoscopic surgeries, and which have been quite successful. So what are the surgeries which come under gynec laparoscopy? We'll begin with endometriosis. So what is endometriosis? Endometriosis is a condition in which the tissue which is similar to the tissue lining the inside of the uterus is found outside the uterus. So because of which it causes multiple problems. This endometriosis can be seen in the fallopian tubes, in the ovary or the lateral pelvic wall. So this condition is extremely painful. The patient presents with painful condition during menstruation, or in a later stage, the patient may experience pain throughout the month. So this requires correction. So in laparoscopy or minimal invasive surgery, it is easier to correct this condition because the prognosis is better after a laparoscopy than an open surgery, which would cause or aggravate the adhesions. This endometriosis is also known to cause fertility problems, which can be addressed by laparoscopy. So what is done in this procedure is, through the laparoscope, we usually tend to drain the cyst and remove the blood content, and also release the adhesions formed because of this condition, all of which would cause relief for the patient, and the patient would symptomatically feel better. The most commonly performed surgery through laparoscopy is removal of an ectopic pregnancy. So what is an ectopic pregnancy? Ectopic pregnancy occurs when the implantation occurs outside the uterus. So the site of implantation can be the tube, it can be the ovary, it can be anywhere, with the most common site being the tube. So in this condition, via the laparoscopic approach, it is easier because it causes less adhesions, and this involves removal of the tube where the conceptus has been formed, or removal of only the conceptus and stitching back the tube. Now coming to the most common surgery performed through laparoscopic approach, being hysterectomy. That is either total laparoscopic hysterectomy or subtotal laparoscopic hysterectomy. So laparoscopic hysterectomies are performed for a variety of reasons. So it can be due to a fibroid or abnormal uterine bleeding, or due to adenomyosis, or many other multiple conditions. That it is most commonly seen in women of 40 to 50 years age group. So post removal of the uterus, the lady will not menstruate further, and this surgery is quite safer and more easier to perform through a laparoscopic approach. We have other indications for performing surgeries through the laparoscopic approach. So we have an ovarian cyst, which is most commonly encountered both in an unmarried girl, or a premenarchal, or during the menarchal age group, or during the postmenarchal age group also. So the cyst, an ovarian cyst removal is easier and more efficiently dealt via a laparoscopic approach. Removal of the ovarian cyst. So removal of the ovarian cyst involves removal of the cystic structure, that is a fluid-filled structure which forms in the ovary. Ovaries are almond-shaped structures which are present on either sides of the uterus. So it is from this ovary that the egg or ova is formed, it matures and ovulation occurs, and it is released, and this egg, it further develops into what is required for conception. So any disorder in this ovary, it may lead to a cystic structure formation or fluid filled sacs. So this can be efficiently dealt via laparoscopy, wherein only the cyst is removed and the ovary is left back intact, and the woman will be able to continue with her fertility without causing much harm to the structure. The other surgeries performed by laparoscopy is removal of fibroids, which is called myomectomy, which is indicated in women who desire to preserve her uterus either for fertility or as a result of younger age group, and the other surgeries being removal of the ovaries, and hysterectomy, which is removal of the uterus, and laparoscopic surgeries for radical excision of the uterus and lymph node dissection, as in case of gynecological cancers, and also conditions to treat being pelvic inflammatory diseases, and also pelvic abscesses, and also pelvic scarring which causes pain. All these conditions can be dealt by laparoscopic surgeries. So are keyhole surgeries something new? Definitely not. These keyhole surgeries were being performed for more than 2-3 decades. It's just recently been famous because of the awareness among the people regarding its efficacy and also shorter duration of surgery and less pain and easier recovery, and getting back to work is easier with such surgery. So the next time you're visiting your gynecologist for a gynec surgery, make sure you ask the doctor regarding the minimal invasive option available, that is the laparoscopy.